I would say we probably have the most hands-on contact with the patient.
Meet Sapan Behar, respiratory therapist at Royal Columbian Hospital. RTs, as they're known in the medical community, are some of the most important caregivers that you may not have heard of for a pandemic like this.
The moment a patient comes into the hospital who's presumptive positive, we would be there assessing the patient.
Life for an RT right now means long hours and intense focus on safety and hygiene. Behar says he washes his hands about 100 times a day right now.
We're right at the head of the bed, right? Like that's the danger zone, right? That's where most of the droplet particles are going to be if a patient sneezes or coughs.
We hear a lot about the need for ventilators, which are a precious commodity right now. But the other side of that is the people who run those machines, and those would be respiratory therapists. We've got about 1,300 in the province right now, and we only have one college that's able to train them. So the safety and security of those healthcare practitioners is critical right now.
Personally, this is my opinion, the weak link is going to be the number of RTs. You know, how many we can bring in.
Behar says each RT can take care of about 4 or 5 patients on ventilators at any given time. But since the expectation is that each COVID-19 patient who requires ventilation may need it for 10 days, a surge of cases at the same time would be a major challenge in BC. He can only promise he and his colleagues will do their best.
I want to assure the public that, no matter, how big or small the shortage of RTs is, we will get it done.
Paul Johnson, Global News.